A 43 years old lady is admitted with cholestasis secondary to a stone impacted at the level of the ampulla of the pater. Which of the following test is most likely to be predictive bleeding diastasis at the time of the ERCP in the particular case? That means a patient suffering from the cholestasis due to a stone impacted in the ampulla of pater. So what test we should do before the ERCP operation? Here are the options. Options are bleeding time, prothrombin time, APTT, platelet count, and factor 1 level. First of all, let's see the different type of the chemical substances which factor affected. First of all, heparin, which is normally present in our body, it name the heparan sulfate, and it prevents activation of the 2, 9, 10, 11. And warfarin, which is the chemical substances or drug used orally, and it affects the synthesis of the 2, 7, 9, 10. And in case of the DIC, it is the 125, 8, 125, 8, 11. And in case of liver disease, 125, 7, 9, 10, 11. And here we can see in case of the hemophilia, APTT increase. In case of the von Willebrand diseases, APTT increase, also the bleeding time increase. Vitamin K deficiency, it increases both the APTT and PT. And what occurs in case of the cholestasis? That means when bile absent from the GIT. So what happens? It reduces the secretion of the vitamin K, and the vitamin K is very important for synthesis of the 2, 7, 9, and 10. And as the vitamin K is not reabsorbed due to the stone impacted and cholestasis, so what happened? 2, 7, 9, 10 is affected, and for this condition bleeding tendency will be increased. And here we can see the vitamin K deficiency, it causes increased prothrombin time and APTT. So we can see prothrombin time or APTT before the examination of the ERCP operative procedure. So here we can see the prothrombin time, vitamin K dependent factor, which is the 2, 7, 9, 10, and APTT, it factor 8, 9, 11, 12. Jaundice will impair the production of the vitamin K. Actually, the absorption of the vitamin K is impaired by the jaundice, because in case of the jaundice, there is the no bile in the intestine and vitamin K is not absorbed. And this is most accurately tested by measuring the prothrombin time. So APTT or PT, but PT is the more sensitive. APTT can be affected by the vitamin K deficiency due to factor 9 deficiency. However, this occurs to larger extent, and it is normally associated with severe liver disease. So APTT also increase, but the sensitivity of the APTT is very low. And this bleeding time is measure of the platelet function. So what is the time? It is the prothrombin time. So before ERCP procedure, a patient suffering from the cholestasis, for the stone, we should do the prothrombin time, and other options here such as the bleeding time, APTT, platelet count, and factor 1 is not true. So only true option is the prothrombin time.